Shante, thank you. We're going to turn now to summer bug bites and how to avoid them and what we are seeing locally. Starting with ticks, emergency rooms across the country are seeing a sharp rise in tick bites. July of this year has already hit the highest number of tick-related ER visits since 2017, and we're only 10 days into the month. Children under 10 and adults over 70 are most likely to be treated in the ER. Men are also treated more often than women. And then there's mosquitoes. We have seen 6 positive cases of West Nile virus in Michigan this year, but none in humans so far. Macomb County is the only local county where a mosquito pool tested positive. So to talk about all of this, we're going to go to the Macomb County Health Department. Tom Barnes is the Director of Environmental Health Services. Tom, thank you so much for joining us. Forgive my point of question, but why? What is happening? Why are we seeing so many more ticks right now than in years past?
Well, thanks for having me on. I appreciate it. Part of it is that this is the time of year where ticks and people are both the most active. So ticks are very active early spring, late spring to early summer. And then as the temperatures start to really heat up, that's when we see a little bit of a die off in activity. Good news is hopefully we'll start to see a little bit of a waning in that as temperatures rise into the later parts of July and into August. But then, of course, it will pick back up again in the fall as temperatures cool off.
You know, I'm sure there are some instances where it's necessary, but I was surprised to see so many people going to the emergency room for tick treatment. I'm not saying you're a doctor, but you probably have plenty of experience in this area. At what point do you need to see a doctor versus trying to take care of this thing on your own?
Well, one of the things you want to look for when we talk about tick bites, mainly what we're concerned with when we do our surveillance in Macomb County is we look for the black-legged ticks, and that's because that's the one tick that can carry Lyme disease. So if you start to see that typical bullseye rash that you get after a bite of an infected tick, that's when you want to be concerned and maybe seek out some professional medical care.
Yeah. So I know at the health department you guys have your own programs and procedures to work on areas, but at home, what can we do to try to, we can't get rid of them, but maybe deter the ticks from our own yards?
Sure. With ticks, really, you want to avoid their habitat as much as you can. So if you're out on trails and hiking, stay on the trail, stay away from tall grasses because that's where they like to quest. At home, keep your lawn cut short. You can also do things like wear insect repellent, something that contains DEET or something that might have, if you don't like DEET, there's picaridin, which is another alternative. These are insect repellents that you apply to your skin, so you do have to apply them again after a few hours. But you can also, I know it's hard to do in these summer months, but wearing some long sleeves and long pants to avoid exposing your skin to getting bit by a tick. And then you can also treat your clothes too with another insecticide. It's actually called permethrin, and this will stay on your clothing through laundering, so it can stay on for a while and help actually kill ticks and mosquitoes too. So a lot of this stuff applies to mosquitoes as well.
Really? Now, when you look at the trends and the numbers, obviously we're seeing more ER visits. Are we seeing more ticks, or are we just seeing more people getting treated for them?
That's a good question. I don't know the definite answer to that at this point, and we definitely are seeing more ticks in our sampling this year compared to last year. The interesting thing about ticks is that they have a lot longer life cycle than most people might think. They can live for a couple of years, which means they can withstand some of our cold Michigan winters. So if we don't see those long, hard freezes, that can get below 20 degrees, if we don't see those going on for more than a couple of weeks, the population doesn't die off, and then we have more in the spring to deal with.
Gotcha. Okay, last question on ticks. Is there anything we can apply to our backyards or maybe a wooded area near our yards that might get rid of them?
I always stick to the things that you can do really for yourself. So I always stick to the insect repellents. Okay. I don't want to name any names, but there are things with DEET in them, and picaridin is the other one. I keep getting the two confused because they sound
but not necessarily
familiar,
treating like a spray on your lawn or things like that.
There might be. I know there's some treatments out there for mosquitoes. I haven't really done a whole lot of research on what it looks like for ticks.
Gotcha. Okay. We are going to take a 90-second break here, Tom, and when we come back, we'll talk about another favorite topic of yours, mosquitoes. I'm sure you can't wait.
Sure. Yeah.
Welcome back to Local 4 Live. Back now with Tom Barnes, the Director of the Environmental Health Services in the Macomb County Health Department. So I wanted to ask now about mosquitoes. What are the numbers and trends you're seeing right now for this year?
So we're definitely seeing some more mosquitoes. That's primarily weather driven. So mosquitoes like it when it's wet outside. And we've had a pretty rainy spring and the first part of the summer too. So and they like stagnant areas to lay their eggs. So that helps with the population numbers that we're seeing now.
Yeah, so, in contrast to ticks, it must be somewhat frustrating because mosquitoes, there's plenty of things that we can do to deter them and deter their populations, including, standing water and things like that. What are your best, pieces of wisdom to pass along to try to avoid them from just multiplying in your backyard?
Yeah. So yeah, you're absolutely correct. So with mosquitoes, they like stagnant water. So if you're like me, I've got my patio furniture covered, and we just had a lot of rain last night. So anything that's out there in your yard that's collecting or holding water, you've got tire swings, flower pots, kiddie pools, all that stuff that can just sit there and collect that water. You want to empty it out as soon as you possibly can. A lot of people like to have bird baths in their backyard too. Those are fine. They actually make a product called a mosquito dunk. It's a little disc that you can put in that bird bath, and it's still safe for birds and dogs to drink that water.
Oh, so I think a lot of people, when they think standing water, like you mentioned, maybe a kiddie pool, but even a small amount of water that's gathered like on top of your patio furniture cover, that's enough for them to be in?
Yeah, because you get other things that are in there too. You're going to get leaves. You're going to get other debris that might fall into there. So it's just a little bit of a mixture there.
Gotcha. Okay. You've talked about repellent multiple times now. Is it the
Yeah.
same as it was for ticks, as for mosquitoes, things with DEET?
Yes, correct. Yep. Same exact process that you would apply for ticks. You do the same with mosquitoes. The difference too with mosquitoes is we worry about the different diseases that mosquitoes can cause. One of them is West Nile virus, as you've probably heard about, and the viewers have probably heard about. Those are dusk biters, so they're out there and active in the evening time. So that's just another thing to think about is, the time of day that you're out there, there's going to be more activity with mosquitoes.
Oh, let me just make sure I understand then. You're saying that you're more susceptible to getting bit by a mosquito carrying West Nile in the evening?
Correct. Yep. So those are our dusk biters.
Oh, okay. I was unaware of that. In
Yeah.
terms of West Nile numbers, then what are you seeing so far?
Well, right now we don't have any human cases, but we do see it in the mosquito pools that we sample. So we have a program here at the local health department, as many of them do in Southeast Michigan, where we intentionally try to catch mosquitoes, and then we send them off to be tested for West Nile virus. And we did just get one back about a week ago that was positive, and that's not too unusual. This time of year we do see it. It's a little earlier, but we do usually see it in July.
Gotcha. Okay, and then again, same question I asked for ticks. Um, at what point do you recommend going to an urgent care or an ER if you do think you might have West Nile? What are the symptoms?
So for most people who get West Nile virus, there's not going to be any symptoms at all, about 80% of the cases. But some people might get fevers, headaches, body aches, those kind of things. And that's all fine. But you want to watch out and make sure those symptoms don't get worse, because if you start to get a really high fever, really bad headache, stiff neck, that could be a sign of something else. It might not be West Nile virus, but it could be. So you want to check out and seek professional medical care.
Gotcha. Okay, Tom Barnes, Macomb County Health Department. Thank you so much for your time on this Thursday morning.
Thank you for having me. Appreciate it.
All right.